All right, well, let's go ahead and get started. As Emily mentioned, I am Molly Kellgren, and I'm the Health Science Education Product Manager here at RealityWorks. Thanks so much for joining us. I know how busy you are, so taking some time out to spend some time is fun. I am a nurse by background. I've worked in hospital settings in the adult ICU. And as Emily mentioned, I've also taught. I've taught nursing at the undergraduate level and directed a simulation and skills lab before going on to earn my PhD in the use of simulation in nursing education. So I'm really happy to be here today to talk about scenario-based learning. We have three main objectives for our time together. First is to gain an understanding of what scenario-based learning actually is. Second is to get some ideas and tips for how to incorporate scenario-based learning into your classrooms. Lastly is to learn how RealityWorks can help you incorporate scenario-based learning into your classrooms, specifically with the Medical Mannequin Quick Scenario Set. So what actually is scenario-based learning? In the simplest of terms, it's an active learning strategy that uses patient stories or cases as a way to immerse our students into real-life situations with the goal of making learning engaging and memorable. We will take the time today to examine our normal teaching practices and how we can use scenario-based learning in a way that is logical, intentional, and appropriate. Understanding this structure is the key to identifying the right times and places to incorporate scenario-based learning. For the theory junkies out there, this method of teaching has been widely proven to be effective, and especially effective in the health sciences, when real-life practice for students is not always an option, due mainly to patient safety issues. Here are some sources for you if you'd like to dig in further. Let's begin by taking a look at how we normally teach our students. We begin with the foundational establishment of facts. This is the heart of everything. Without these facts and this factual knowledge, we can never expect our students to succeed in health science. Consider this factual knowledge to be the bottom row of our house of cards. Next would be to add some context so that students can begin to learn how these facts can apply to real life. Give them opportunities to think through different scenarios and recognize the consequences of their actions, both correct and incorrect. This may include discussion with other students, discussion postings on your course website, or even written responses. This added context really gives students a taste of what situations they might encounter in their future practice. Being able to directly visualize the connections between their activities in school to what they will be doing once they get a job provides real relevance for students, and as a result, increases their engagement. They understand why they're doing these activities in school. The key here is that in this stage is that students have time to think through their choices, change their minds, and even course correct. This will probably be a bumpy road with starts and stops, wrong turns, and lacking the smooth performance of someone with more experience. Consider this to be the middle level of the house of cards. The highest level of the house of cards is the ability to take the facts, remember how they've applied those facts in the past, and then act on what they've learned right then in the moment. A simple non-health science example would be learning to drive a car. Before we ever let someone climb behind the wheel, they're expected to pass a written factual exam that tests on things like the rules of the road, for example. One rule they might learn is about the right of way. In various circumstances, who has the right of way and who is required to yield to another vehicle? That's level one. Now we have passed our factual exam and we're ready to start applying those rules. We may have some behind the wheel training where an instructor is right beside us in a simulated driving environment. We can practice applying the rules of the road in this less stressful situation with time and opportunity to correct our course until we get it right. This is the middle level of our house of cards. The highest level is when we are tested in real time to see if we can apply our knowledge of the rules of the road. Have we mastered the content? Can we be safe on the road? We expect, for the safety of all, for people to know and follow those rules of the road. It's the same in health science. You can see that if one of these levels is lacking, our house of cards is going to fall down. We are going to crash that car. Something can happen to our patients. So let's bring this back to health science with another example. In order to be a safe and successful health science practitioner, a student needs to understand the respiratory system, for example. They need to understand structure and function, anatomy and physiology, and other factually based details about the respiratory system, like which vital signs are associated with the respiratory system and what normal and abnormal readings look like. A test question might be, what is the normal oxygen saturation level for a healthy adult? A, 72%, B, 88%, C, 97%, or D, none of the above? This type of question is simple fact regurgitation, but it is necessary to establish baseline understanding for our students. We structure our classroom at this level to be able to answer these fact-based types of questions. This is not the right time for incorporation of scenario-based learning. Once we have established that our students know certain facts, then we can ask them to begin to apply those facts to real-life situations. We can do this by adding context to our class activities. How do we do this? Some examples could include written case studies, discussion board postings, small group or parent share conversations, and large group discussions. But you really can get creative here. For example, you could post a video on your class website that students need to respond to. You can ask that they upload a video response to a scenario. Let your creativity show through here and feel free to try new things. In our example today, we will be completing a scenario-based written case study. We introduce Lisa to the students on a worksheet. They are given basic information about Lisa's situation. Lisa is a 68-year-old female who came to your urgent care clinic with complaints of shortness of breath. Her blood pressure is 138/72, her heart rate is 94, respiratory rate is 22, and her oxygen saturation is 90% on room air. Her past medical history includes tobacco use and hypertension. The students are asked a series of questions that they must answer independently. Then later in class, they will pair up with another student, share their answers and rationale to work through their reasoning and come to a consensus if their answers differ from each other. So for this patient with this story, what is the priority intervention for Lisa? I'm sorry, I'm having a technical difficulty. Hang on just a second. And there we go. Sorry about that. So for this patient with this story, what is the priority intervention for Lisa? From the choices provided, the student will need to rely on facts that they have learned previously. They can rule out A, because although education is important, it's not the priority for this patient. The students have already learned that education should not come at times of physiologic instability. They can rule out B, because from what they know about the structure and function of the lungs, breathing is often easier when sitting up, not lying flat. They think about C as a possible correct answer because they remember that normal oxygen saturation is 92% or above. So this patient is below that. They can rule out D because they remember that if they address an underlying stressor, it's very likely that her blood pressure will come back down once her breathing becomes easier. They return to C and select it as the correct answer. So what we have done here is taken the foundation of knowledge we hope our students have and create opportunities for them to think through what they know and how it applies to the current situation, a situation they're likely to encounter often in their professional practice. When they pair up and discuss, they can talk through how they made their decisions with one another. This is one example of scenario-based learning. You may be recognizing at this point that you have already started creating context for your students without even recognizing it. That's amazing. If that's the case, now you can move forward really intentionally and thoughtfully for incorporating context into your classroom. So now we move to the highest level on our house of cards, the actual driving of the car. And maybe this is where our car driving analogy ends, because in health science, we still have determined that our students are not yet ready to be let loose on the streets without more practice and supervision. So instead, our highest level of the house of cards actually happens when they're still in school. We often use simulation or role-playing activities at this level. But again, this is an opportunity to be creative. Have them record a video demonstrating their abilities in real time. These types of activities require our students to build on their foundational knowledge, use what they've learned when they've had practice applying that knowledge, and intervene with simulated patients all in real time. This is when we instructors have implemented a scenario for students to actually do, and we know what we're looking for them to do. We have expectations for actions that to us will demonstrate that they have all of the knowledge they need. Now we're moving to activities for students that get them away from just writing or talking about what they would do in a certain circumstance, but actually asking them to do it. This is role play. This is simulation. In the simulation scenario, in the case of our patient Lisa, the students are given the same contextual information as in the previous example, but we are increasing the difficulty as students move further towards independence. So we will now expect the student to assess the patient, to obtain the vital signs themselves instead of being given that information. Perhaps part of the simulation setup was that Lisa is lying flat in bed. We instructors would expect that the student with knowledge about the respiratory system would gather vital signs, recognize that the oxygen saturation is low, apply oxygen at 2 liters via nasal cannula, and to raise the head of the bed. These expected actions are concrete and objective, and they demonstrate application of knowledge. If one student in particular did not perform one of the expected actions, this can be a signal that part of their foundational knowledge is lacking. So why so much detail today about these various levels of learning in our house of cards? It's really to paint the picture to understand that scenario-based learning is not one discrete activity. It's an umbrella of types of activities that can meet your teaching objectives. And also to demonstrate that there are times and places for scenario-based learning. In our house of cards, scenario-based learning is used in both of the 2 highest levels. So let's move on to tips. I have listed 5 tips here, and we'll talk about each one of them separately. So if I'm writing my own cases or scenarios, what elements do I need to include for it to be truly scenario-based? First is context. The actual definition of the word context is, quote, the circumstances that form the setting for an event, statement, or idea, and in terms of which it can be fully understood and assessed, unquote. The crux of this is to provide enough detail for your students to understand the situation they're being placed in. If you're trying to figure out if you have too much detail or not enough detail, have a teacher colleague work through your scenario-based learning activity. It really doesn't take long, but having a fresh set of eyes on your work will help inform any revisions you should make before trying out your activities with your students. Next is decision-making points. Even with appropriate levels of detail in your context, if the student is not required to decide anything, the activity will seem pointless and you will lose the student's engagement. The context should adequately set up your situation, and then your next step should be to figure out what students should actually do. In our earlier example, we wanted to determine what intervention Lisa, our smoker with shortness of breath, needs most urgently. That is the decision point. The last component that should be present for all your scenario-based learning activities is clear learning outcomes. And of course, you already know this. I'm sure you're used to developing learning outcomes and having them guide what and how you teach. It always bears repeating, though, that these objectives are our North Star and helps keep us instructors moving in the right direction. Tip number 2, are you questioning when it's appropriate to use scenario-based learning? Good rules of thumb to answer this question are only after foundational knowledge has been established. If you introduce a scenario before your students have the basic levels of knowledge or skill, they will end up confused and frustrated. Use scenario-based learning when you want to examine students' decision-making capabilities. Having students practice verbalizing how and why they make decisions the way they do. This can really help support the correct decisions they make and can really help redirect when they're heading in the wrong direction. There are 2 options for which circumstances scenario-based learning can easily be used in, and I see great value in both. First, there are the rare instances that you can't guarantee that all students will experience in, say, a clinical setting. Examples of these from nursing might be a code situation or recognizing a patient who is in the beginning stages of sepsis. These are situations that are incredibly important for students to know how to work through when the real deal presents itself. The other great opportunity for use of scenario-based learning are the situations that students will see often in their professional practice. So you want to ensure that they show mastery of these before going out into the real world. An example of this type of scenario from nursing might be a situation where the student is to administer medications, but they should recognize a contraindication, like a scheduled beta blocker when the blood pressure is low, or a scheduled heparin injection when the patient is actually supposed to go to surgery. These are situations that they will encounter almost daily in professional practice. So getting them used to making those decisions in real time is imperative. Tip number 3, should you create your own scenarios or should you purchase ready-made scenarios? The answer is really either, or both. Creating your own scenarios can be incredibly time-consuming, but the positive side is that you will have scenarios that are tailored exactly to your course and your learning objectives. If you choose to purchase, obviously you're spending money, but the convenience of ready-made scenarios can lighten the load significantly for instructors. If you go this route, make sure you review the cases to make sure they align with your desired outcomes. You should always feel free to tweak ready-made scenarios to meet your objectives more closely. Tip number 4, consider a mix of media. Scenario-based learning does not always need to be a written case study or a full-blown high-fidelity simulation scenario. Consider small steps to mix things up. If you're introducing a patient case, could you record an audio of that patient delivered in first person to help the students get to know them better? So instead of having them read about Lisa, record Lisa talking. Hi, my name is Lisa. I'm 68 and I've been feeling pretty awful today. I just can't seem to catch my breath and it's making me freak out a little bit. I do smoke and I know I should quit. My doctor has talked to me about that pretty often, and so on. This personalizes the story of the patient and can really engage students in the activity. On that same vein, can you find a picture of Lisa to go along with your audio message? Students today are so tech savvy. Can you ask them to video a response to a scenario instead of writing their responses down? Can you record a video to introduce a scenario? These options do not need to be movie quality. Using your cell phone is more than enough to get your point across in a way that draws students in. Finally, don't get stuck in one type of media. Mix it up. Tip number 5 is really to just be patient with the whole process if using scenario-based learning is new to you. Some activities will be a home run the first time you try them. Some will be complete flops. Most will fall somewhere in the middle. Your students learned, they were engaged, but some detail here or there could be improved. That's why we need to be constantly evaluating what we do in the classroom. So never stop trying to make good activities even better. Be patient with the students as well. If scenario-based learning is new for them, it can take a couple of tries for it to feel less awkward or uncomfortable. They will soon see how much more interesting it is to be actively involved rather than just listening to the sage on the stage. But don't just scrap all of your plans if the first attempt doesn't go over as well with your students as you'd hoped. So how can RealityWorks help you get started? We have a number of products ready for you to grab and implement. First is our medical mannequin quick scenario set. In this one set, there are 100 different scenarios, from pediatrics to adults to geriatrics, from skill-based scenarios to scenarios emphasizing soft skills like communication. There's a huge variety in settings, including clinics, inpatient and outpatient settings, as well as community sites. The scenarios each include objectives, student roles, setup instructions, pre-brief questions, and simulation scenarios with expected student actions already laid out for you. These scenarios follow the INACSL standards of best practice. That's the International Nursing Association for Clinical and Simulated Learning. So you can be assured of their quality. There are 5 sets of scenario cards included, so you can creatively use these in smaller groups in your classroom, as well as a printable workbook that's all included with the set. So if you find yourself short on time, but really motivated to start using scenario-based learning in your classrooms, please consider adding the Medical Mannequin Quick Scenario Set to your toolbox. Additionally, we have created scenario cards for purchase that address many different areas of focus. We have sets that focus on different career paths like nursing, medical assisting, sports medicine, EMT, and dental. We also have sets that focus on global skills like employability and leadership. If you have colleagues that teach in other pathway programs like agriculture and trades, we have them covered too. Visit our website to learn more. We also have some free assets that you can take advantage of. First is a set of scenario cards that can be used in your career exploration exercises. So if you have beginning students that haven't yet committed to a specific CTE pathway, these can be extremely helpful. We also have a sneak peek available of our workplace scenario cards. 3 scenario cards each in the areas of agriculture, health science, trade skills, and family and consumer science. These can give you a taste of what is available in our full packs of scenario cards mentioned previously. So I just want to thank you for your time today. I'm going to pass the baton back to Emily to help with any questions that may have come up. Emily?
Yep. So one question that came up is, Molly, do you want to go over what everybody's going to be receiving after the webinar today?
Sure. You're going to get a link to the recording of this webinar. You're going to get the actual PowerPoint deck that I just went through, and that includes all my notes. And you will get, oh boy, I can't remember what I had asked you for in terms of the free assets that we're going to be linking. Do you have that handy?
Yeah, we're also going to be giving you the Medical Mannequin Quick Scenario Kit sample. So
yeah, that's right. There are 2 scenarios that we're going to be giving you for free, and it'll really give you an idea of how we've laid out each of those 100 scenarios in that Medical Mannequin Quick Scenario Set, so that you can feel good about what you're looking at purchasing if you're interested in that product.
Awesome. And another question that came in would any of these scenarios apply to health information management or health service administration majors?
Nope, these are really patient care, direct patient care oriented scenarios.
And Molly, where can they find pricing for our medical mannequin quick scenario kit?
Everything is on our website. Yeah, so if you just go to www.realityworks.com and click on products for health science, you can either scroll through and find that product on our website, or you can type into the search bar, and that will lead you directly to that set to take a look at. But just right now, currently in 2024, this set is $999.
Awesome. Thank you. And I am not seeing any additional questions coming in at this time, but we can leave it open for another couple minutes if you'd like.
Great. People can also feel free to reach out to our product support if they have further questions to connect with the person that can answer them for you. So if you're not kind of an in the moment person and you need time to process your questions, this is not the last time that you have the opportunity to ask them. So we always want to make sure that your questions are answered.
We did have a question that just came in regarding, can we share your leadership? And I'm not sure if they're talking about our leadership soft skills program scenario set or not. And it is anonymous, so if you did ask that question, if you are looking for the product or kind of more information about that question, then Molly can answer that.
There is on our website, I'm just going to take a stab in the dark here. The leadership soft skills scenario cards, if you look for that item on our website, there is a sample available on that product page on the website. So you can click that link and you can get access to a sample of the leadership soft skills.
And I also dropped the link to the leadership soft skills program in our chat for anybody that was for that.
Thanks, Emily.
Awesome, Molly. And I'm not seeing any additional questions coming in at this time.
Great. Well, I just want to thank everyone again for your time today. Hopefully you found a nugget or two in here that will be helpful, and you can be looking for that email coming into your inbox in the next day or so. So thank you so much.
Thank you, everyone. Have a great rest of your day.